Exposure to Bloodborne Pathogens by Gabrielle Deroshin. Introduction. According to the U.S. Occupational Safety and Health Administration, or OSHA, bloodborne pathogens are infectious microorganisms present in blood that can cause disease in humans. OSHA defines blood as human blood components, and products made from human blood. Some of the most common bloodborne pathogens include HIV, which leads to AIDS, hepatitis B virus, and hepatitis C virus. Transmission. Transmission of bloodborne pathogens can occur between healthcare professionals in many ways, such as contact with infected blood through non-intact skin, contact with infected blood through mucous membranes, such as the eyes, mouth, or nose, or needle sticks with infected blood. Bloodborne pathogens are not transmitted through casual contact, droplet, or oral fecal route. HIV can also be transmitted through bodily fluids, such as semen, vaginal fluids, rectal fluids, and breast milk. Protection. The CDC has developed guidelines for healthcare professionals to follow. The use of PPE, or personal protective equipment, which includes gloves, gown, face shields or masks, goggles, and shoe coverings. Puncture-resistant sharps containers. These containers should be located closely to where sharps are being used to reduce risk. Safety devices can now be found on the actual sharps to help prevent any unwanted injuries. The guidelines also include HPV vaccination provided by employers and yearly training for workers considered at risk. Standard precautions. Standard precautions are practices used throughout healthcare to prevent the spread of pathogens and infections. These include hand hygiene, which is washing with soap and water or an alcohol-based rub. Hand hygiene should be performed before and after direct contact with every patient, immediately after contact with blood or bodily fluids, immediately after taking off gloves, and whenever hands are visibly soiled. Standard precautions also include PPE, which serves as a barrier between pathogens and healthcare workers, and sharp safety. So sharp safety includes new needles after every injection, safety device activated as soon as possible, and sharps placed in the sharps container after use. Reporting exposure. It is important for workers to report any exposure to pathogens with the following information: date and time of exposure, how and where exposure occurred, devices involved, description of the exposure, description of the source of the exposure, HPV vaccination status, and management and follow-up after exposure. Reporting exposure is an important component in providing safe care. Ensuring safety minimizes the risk of harm to patients and providers. Cues in. The exposure of bloodborne pathogens can be directly related to the cues and competencies. Evidence-based practices are what leads healthcare professionals in their practice. It is important for workers to value the need of ongoing improvement based on new knowledge. This includes following the guidelines developed by the CDC to reduce exposure. Overview. It is important for healthcare workers to be proactive in taking the proper safety measures, not only for their patients but also for themselves. Continuing education related to exposure of bloodborne pathogens is crucial in decreasing risks associated with exposure. Reporting exposure is critical in order to get proper management or treatment needed to protect staff members and patients from harmful outcomes that can be associated with exposure to bloodborne pathogens.